I thought that this section wouldn't really be complete without some case histories because I'd like to show you how I use what you've learned so far in assessing people in a client consultation. So, talking about the principle of less is more, we saw this image earlier where this girl has just got one pigment, no pigments in the other eye. And I want to draw your attention to this little mark here. Now, this is called a Miller sign, and you learnt about this in the sclera work. So let's just look at both eyes, and you should always look at both eyes before you make any statements, because one eye doesn't tell the whole story. So we've got the two eyes there. Looking in the right eye, we've just got one pigment, and it is black. So we did say people with black pigments are usually related to somebody who has developed some form of cancer. Now, if we look at her other eye, and you've seen these eyes before because in the sclerology work I showed you this is the development of what I named the Miller sign. So it is a sign of a skin change and is often linked to things like skin cancer. It could be a BCC, an SCC, or worse, it could be a melanoma. Now, I didn't really notice this sign on her first visit, but I always compare the photos I take on the first visit with the photos I take on subsequent visits. I still didn't really notice much from here to here, but when I looked from here to here, I noticed that there was definitely a developing sign. And so I inquired about whether she had any skin changes. And she had multiple moles on her back. Her skin specialist said that she had a mole farm. She had so many moles, and she had already had a couple of suspicious moles removed, but she was aware that there was one on her back at the moment that seemed to have become raised. So, of course, I sent her off for an assessment, and that particular mole was subsequently removed and found to be precancerous. So interesting, isn't it? And just to recap, what is it that we're looking for as a sign that a skin lesion could be potentially a skin cancer? So we use the ABCDE method. So first of all, asymmetry. Secondly, B is for border. Has it got an irregular border? C is for colour. So if it's variegated, that's a suspicious sign. And D is for diameter. Melanomas are usually larger in diameter than a pencil eraser. That would be worth having a look at. And E is for evolving. So when a mole changes in size, shape or colour or begins to bleed or scab, this points to danger. Now, what do these guidelines make you think of? Didn't we say that if a sign in the iris is asymmetric or has an unusual border, or if it's got a variegated colour, or is larger than 3 millimetres in diameter, or thicker than a mil, we should check it. Interesting comparison. This young lady taught me more about breast signs than any single person that I've ever consulted. She came to me selling advertising, and so that she would understand what it was I needed to advertise, I suggested that I put her eyes on the screen. And when I did so, I couldn't help but notice that she had a black pigment here and some pigmented tophi. And I knew when I saw her that black pigment did link you to someone who had had cancer, and I was just beginning to understand the implications of pigmented tophi. So I casually asked her, had she had any issues with her breasts? And she was stunned because she had just recently had a mastectomy. So she asked me, did I know which breast was it in? And I picked the left breast. Is that what you picked as well? in light of the iris signs, that's a reasonable assumption. But to my surprise, the mastectomy had been on her right breast. Wow. So in the integrated chart, you'll notice that the right breast, which can be indicated by any signs in this entire blue area, this is the upper breast, the lower breast, the lateral breast, the medial breast, and the nipple. Any sign in here can be an indication of the breasts. But notice that in the right iris, there is also an area here that would indicate the left breast. And vice versa, the right breast is indicated in the left eye in this region. So now have another look, and you will see that we actually have pigments on a defect sign in that region. And we also have pigment here and pigmented tophi here. So you don't need a dramatic sign to indicate pathology. It can be quite subtle. And I think I've mentioned to you before, people do get pathologies without any iris signs. But the thing that had really happened here for this girl, I had truly, in effect, pointed the bone at her, as we say here in Australia, because I'd made her afraid that her left breast would also produce a pathology. The reasons that I chose the left breast was because of the obvious black pigment here and also the pigmented tophi. The reason she was so alarmed when I did pick that breast was because her mother, maternal aunt and maternal grandmother had died from breast cancer, and her sister had also been diagnosed with breast cancer. So based on her family history and these iris signs, I actually recommended that she see her doctor about prophylactic surgery. She thought that wasn't a bad idea, and I didn't see her for 3 years. I didn't see her for another 3 years. And she came in to tell me that it took her 3 years to go ahead and seek out this prophylactic mastectomy. And the doctor was very happy with the suggestion. And unfortunately, though, when he took off her nipple, he discovered that she had Paget's disease. What a tragedy. So time is of the essence. Could she have avoided breast cancer had she had the surgery 3 years prior? Well, in all probability. I mean, that's tragic, isn't it? So I'm giving you this case history to show you to take signs seriously, to try not to be alarming when you make your assessments, but to be assertive when making recommendations. Unfortunately, this young lady did lose her life to breast cancer, and what a tragedy. If only she could have taken some advice earlier. Now, to just recap on the importance of pigments in the iris. This is a left eye of a young woman aged 42. I've mentioned before, but I want to really emphasize that pigmented tophi are always more significant than non-pigmented tophi, since they can indicate activation of what is only a disposition. In this young lady's case, you can see that she has many tophi, and right in this area we've got pigmentation on top, and it's right next to some defect signs in the tissue that can represent the breast. So this plus tophi plus this is an indication that I would say, how often do you check your breasts? I would also explain to her that people with tophi have a higher disposition to forming lumpy breasts than those who don't have them. And that when a tophi is pigmented as well, it's a good idea to just make sure that you check your breasts regularly, because as we age, so I would say particularly after the age of 40, instead of just lumpy, breast tissue often becomes quite grainy. In my clinical experience, lots of women really don't like examining grainy breasts, especially when it's their own. And so they would be more likely to miss something if there was anything new. So it's not a definite pathology sign, but it does suggest this person needs to keep an eye, a regular eye, on the health of her breast tissue. And while we're at it, since we're sending her to her doctor, we can see that she's got a pigment here on the cervix area. How long since she's had a pap smear? And while you're at your doctor's, get him to check that for you as well. And always get them to come back to you and let you know their results. So just say, once you've got your tests done, or once you've seen your doctor, let me know how you go, okay? Because we're not born with these pigments. These pigments come as we age, as we make certain lifestyle choices. We've seen all the reasons why we develop pigments. So let's just get those checked out. And I'd like to finish this section with another case history that really shows us the value of secondary pigments. So here's a young female, 38 years old. She is a kidney lymphatic hydrogenic. So the kidney lymphatic aspect focuses on her disposition to renal issues. Does she have a parent with renal issues? Yes, she does. Her father is one of the case histories that I'll be presenting to you in the lacuna segment, and I'll mention him again. So here she is. She's got yellow pigment in her eyes, which is one of the identifying features of the kidney lymphatic constitution. And as the name suggests, the focus for the kidney lymphatics is the renal system. Now, amongst other issues, the kidney lymphatic type is prone to joint problems, especially if they're careless with their liquid choices. So that could be that they're not drinking enough water, or they're drinking too much of another type of liquid. The hydrogenic aspect has much to do with the regulation of fluids. So it's a close cousin to the kidney lymphatic type. And one of the risk factors to this diathesis is that they can develop high blood pressure and diseases of the veins and urinary channels. So that would be something we would say to her, keep an eye on your blood pressure as you get older. 38, she's probably not very likely to have high blood pressure, but that could happen down the track if she doesn't treat herself well. One of the interesting aspects of the kidney lymphatic constitution is that they tend to be very restless during sleep time, and as a child she was almost impossible to keep covered. She'd always kick the covers off by the morning, and over time she did develop chronic sinusitis. So let's have a look. What does the iris tell us? Well, first of all, yes, she has sinus pigmentation. Now, her mother and her mother's grandmother both had gallstones, and we see that she has a gallbladder lacuna. That's a very small one here, but in her case it does have a perifocal pigment, which means we need to ask her, have you had any issues with your gallbladder? And the answer will be yes, she has had a couple of episodes of cholecystitis. Notice also that she's got a vascularized radial with focal brightening in the liver area. And that's very often what you see. So if a person has got gallbladder stress, they can also produce irritation in the liver. Now, I mentioned spinal issues being a disposition that goes along with the kidney type. She has cervical and lumbar pigments. Children are not born with these gradually develop over time. And she's also got a vascularized transversal in the lumbar spine. Can you see that it's quite red just here? And it runs up to this area where we've got a little defect sign. So how is her spine? Well, she has had ongoing spinal problems since an accident in her early 20s. So again, like we mentioned in previous slides, that we tend to develop pigments where we've had a significant trauma that needed maybe heavy pain medication, which is the case for this young lady. And lastly, we've got a contraction furrow and a perifocal pigment right on her knee reflex. Here we see a rhomboid-shaped heart wedge next to a broken collarette. So we know that there's some kind of heart issue in the family, and the broken collarette suggests that it's to do with heart rate. So does she have palpitations? Is there any arrhythmia? Her great-grandmother needed a pacemaker for arrhythmia. So it's interesting that it would show right here in a broken collarette. Now, in Iris 2, we'll be doing birth order, and her mother's mother is a very close connection to her in birth order. So it's interesting that she got this particular mark on the left eye, which is her mother's family's eye, and we'll talk about that some more. We have humeral tophi, and we have a urinary transversal. So here we've got this little thing, and again, this suggests that we've got some kind of renal issue. Notice that there's also a pigment in that region. So what is the renal issue? There is some weak connective tissue in the renal area, and again, a contraction furrow in the knee. Now, I'm not sure whether you know, but the knees are on the kidney meridian, and signs in the knee reflex can also be relevant to the kidneys. This child had her first episode of renal colic at the age of 14 and another at 17. And here is the sign in her sclera that shows that history. So this is called a spider leg glomeruli, which indicates decreased surface blood supply due to capillary blockage. So that's to do with blood pressure usually, but I have seen on many occasions that this vessel also indicates historical renal issues. And I mean, imagine having your first bout of renal colic when you're still a child. It's just a hideously painful condition. And that marking there has never gone away. So she developed this mark when she was 14, and here she is at 38, she still has that sign. And just a little bit of light-hearted humour, occasionally you'll see a pigment with a likeness to something tangible. And I'm going to ask you, can you see a pigment in this eye that looks like a man? And is there any relevance? Who knows? I hope you've really enjoyed this section. I hope you've learned a lot more than you used to know about pigments. Up to 80% of people have secondary pigments. These are, of course, much less common in brown eyes, and they are also referred to in mainstream medicine as iris nevi. But I just wanted to show you an example of what happens in 20 years. So I'm sorry for the grainy images, but 20 years ago, photography wasn't nearly as good as it is today. But can you see there is no pigment here? And 20 years later, this young lady has developed a definite pigment in the kidney zone. And here we've got no pigment in this region, and yet we have a pigment here in this region. So pigments tell us a story. They tell us where to look. And based on colour, they tell us the questions we need to ask. So in this section, you've learned that primary colour is genetic. You'll never get rid of it. You are never supposed to get rid of it. Even if you have it lasered out, it comes back. That pigmentation accumulates with age or trauma or injury. Pigments can be personal, so they really apply to me, or transgenerational, so they can indicate family issues from past generations. You've learned more about heterochromia and that they show that location is significant. And we've learned to differentiate between the meaning of gastrointestinal pigment as opposed to ciliary pigment. And we learned that there are three main classes: gastrin, which is the oranges and reds; melanin, which is the browns to black; and rosine, which is yellow. And then we looked at some ocular emergencies, so you know when to refer. And we finished with some case histories. I hope you really enjoyed this section. I did love recording this. The major thing that you should take home with you from this section is that perifocal pigment is a primary iris indicator, one of the most significant markings in the iris. If you'd like to give me some feedback, I'd absolutely love to read it, or even better, if you want to record a video or comment on the Integrated Iridology discussion group on Facebook, that would be just awesome. So I hope you enjoyed this. The next module is transversals.